Well, let's take a local look at this before we hear from the government. Dr. AJ Verma is a consultant working across Northamptonshire. I spoke to him ahead of the show today and began by asking whether he agreed with the statement that the NHS was on the brink of collapse.
Yes, I always think when we use the term collapse, we see this, we vision this dramatic failure of everything, in a very short period of time. But actually, this is a slow deterioration of the services we can provide, which is happening over weeks, months, and years. And it is getting to the point where the service we can deliver is becoming more and more not meeting the needs of our patients.
Is the root of this the lack of availability of staff and so many staff leaving the service, or is it more complex than that one issue?
It's multifactorial, so absolutely, we've got more people using the service. As we get an ageing population, we have more demands on healthcare. We are massively short of staff. The pandemic itself had a huge effect on people, on our colleagues and ourselves, our mental health and physical health, and made a lot of us reevaluate what's important to us. There is a huge issue with our terms and conditions, so our pay has dropped in real terms over the past 12, 15 years by 20 to 40%, and currently with inflation, double digit, it's really affecting people's pockets to have a year-on-year drop, a real-term drop in pay. Sorry.
Do you witness that demoralisation amongst your team, amongst the people you work with? Do you see that demoralisation on a daily basis?
Absolutely. It's what we call moral distress, and what it means is we were trained to deliver a very high quality service, and when we, despite our best efforts, can't deliver that, it's very difficult for us. We find it very distressful. We take no joy at all to have patients waiting and suffering. It really affects us physically and mentally too. So it can be, especially on call days, very, very tough and very demoralising for myself and our teams and across the NHS.
Former Health Secretary Jeremy Hunt, of course, now he's Chancellor, and he said the NHS has had lots of money, and moving forwards there will have to be efficiencies, which I guess most people understand as cuts. Has the NHS had enough money to run well? And if so, does it waste some of the money it's given?
So with healthcare, it's a choice you make as a society. In the end, as our populations are aging, as we all get older, we use more healthcare, and the population of this country is aging, and it's growing as well. So we need more resources into healthcare. There's absolutely no doubt that for the needs for the population, we've been massively underfunded. We are short of money. So whilst there has been a huge amount of money pouring in, it is not enough to meet the needs. Now, is there waste in the NHS? When you've got a huge organisation, one of the biggest employers in the world, there will be a degree of waste, but not out of proportion to what we do. So, yes, there could be some efficiencies made, but not enough to make a dent on the shortfall of what we actually need. So it is a political and a societal choice about funding and whether we are willing to fund healthcare more to have a kind of better well-being and health of our populations.
If you were Health Secretary, what would you do on day one to make the NHS function better? What would be right at the very top of your priority list?
Well, going back to Jeremy Hunt, it's really interesting actually, and I'll draw a parallel. So he was Health Secretary for 6 years,
Yes.
I think the longest serving ever. And he oversaw during his time a kind of austere funding of the NHS and a kind of war with our junior colleagues in terms of imposing a new contract and clamping down their terms and conditions. After he had that post, he was chair of the Health Select Committee and kind of repented a lot about some of the mistakes he made as Health Secretary. And in August this year, he tweeted out, whilst he was going for the leadership campaign, things he wanted to change, including a massive overseas recruitment drive, an exemption for some of the punitive pension rules for senior doctors, and also more flexible working for health professionals so that less of them feel they have to leave due to the lifestyle of difficult working that can stop people from looking after children or living their lives. I don't think when he did that he thought he would be Chancellor. Now, the issue is he's got this very difficult situation that the economy has been tanked, and whether that's due to political decisions or worldwide decisions or a combination, that is a fact. And because the government, the incumbent government, have ran an austere funding of the NHS and a below inflation pay and terms and conditions for its staff, he's in this difficult situation that he's got a huge group of underpaid, unhappy staff who are all threatening industrial action. So I don't envy, I'm not going to claim that's an easy decision and I could be in that position and say, oh, we just do this, we just do that. But in the end, the government, if they look over long term, should have planned for this. So at the times when the economy was doing quite well, that's when they should have addressed the terms and conditions and the funding to say, we've got a bit more money and flex in the system now in the economy, so we're going to increase the funding, address some of the shortfalls, address the shortfalls in funding for staff salaries that have been short over a decade. But in the end, they chose to run an austere program, and now this is biting them back because, with this double-digit inflation, our colleagues are really struggling.
Do you fear for the future of the NHS as a service that is free to all at the point of use?
Absolutely. I'm very fearful, and some of the rhetoric that comes out really does worry me. So when you say, I've heard on Newsnight a few weeks ago, some think tanks saying, well, we should charge people to use the NHS, even an arbitrary fee. But the issue is that for those who can't afford it or those who money is tight, it will put them off using healthcare. And actually, a lot of health conditions we have, the earlier we know about them, the better the outcome. So if you've got a suspected cancer, if you put off your symptoms and you present very late and it's advanced cancer, your outcome's going to be much worse. So it's actually really important we have a really good, strong, prompt, reactive health service to keep our population well. And well people go to work, well people pay taxes, from that point of view. So it's really important that we do maintain a really good health service, otherwise we'll all suffer. And if you look in countries where it's insurance-based, like the US, their spending on healthcare is huge per capita population, but the inequalities between those who can afford it and those who can't are scary.
Really, really interesting. Dr. AJ Verma, a consultant working across Northamptonshire, speaking to me earlier today. Well, Prime